Welcome back to my channel. I'm here to share the latest updates on lymphedema risk reduction practices for breast cancer survivors. In this video, we're going to cover some key updates for breast cancer related lymphedema risk reduction practices for you to implement. I'm Dr. Alex Hill. I'm a board certified physical therapist specializing in pelvic health, oncology, and lymphedema. Make sure you subscribe to my channel for even more lymphedema content. Lymphedema, a chronic condition causing swelling due to lymph fluid buildup, is common after breast cancer treatment. About 1 in 5 or 20% of breast cancer survivors will develop lymphedema after treatment. Prevention and early management are crucial to managing lymphedema, and keeping up with guidelines can help improve your outcomes. Now, many guidelines for lymphedema risk reduction practices are over a decade old, and some have either been disproven or have insufficient evidence to support them. A recent consensus guideline was published that combines recent data with consensus expert opinion on updated evidence-based recommendations for reducing the risk of breast cancer-related lymphedema. So let's hit some of those key points that have been updated and proven to be helpful. First up is prospective surveillance. So it's recommended for people at risk of lymphedema to undergo regular screening with baseline measurements before breast cancer treatment even starts, and to have regular follow-up measurements and check-ins. Early detection and monitoring can help prevent progression of lymphedema to more advanced stages of lymphedema, which is why ongoing and early monitoring is so important. Next up is exercise. So exercise is encouraged for breast cancer survivors, whether or not you have lymphedema or you're at risk for lymphedema. Supervised and progressive resistance and aerobic exercise has been shown to be both safe and beneficial in promoting lymphatic flow and reducing swelling. So if you've been told to never lift more than 20 pounds or something like that, it's just simply not true. I've worked with breast cancer survivors who've gotten back to CrossFit, powerlifting, and even just lifting their kids or doing heavy yard work and doing things that are more than 20 pounds. So the key though is progressive training, and make sure you work with a trained healthcare provider like a physical therapist, occupational therapist, or even a personal trainer or exercise physiologist who has additional training in oncology and lymphedema. All right, our next one's gonna be a little controversial, and it's been controversial for a long time, and this is on blood pressure and skin puncture. So historically, it's been recommended to never take blood pressure or puncture the skin for injections or blood draws on the at-risk arm. But studies over the years have suggested that isolated blood pressure readings and injections in the affected arm do not significantly increase the risk of lymphedema. So that means if it's just a one-time blood pressure check at the doctor, probably fine. However, repetitive or prolonged pressure readings or injections or blood sticks ideally should be avoided to prevent worsening of lymphedema. At the end of the day, I and many other lymphedema therapists still recommend to use the non-affected arm if you can, but if you forget or if it can't be avoided, the risk of developing lymphedema is low, and you just need to monitor for any swelling in the days after. Next up is skincare and hygiene. So maintaining good skin hygiene is essential to prevent infection, which is a known risk factor for lymphedema. Routine use of moisturizers, insect repellents, and sunscreen, as well as immediate care for cuts or bites, is recommended. If you have signs of skin infection like redness, warmth, pain, increased swelling, or flu-like symptoms, seek medical care immediately. All right, our next one is another one that can be a little controversial. So this is talking about use of compression garments to prophylactically try to prevent lymphedema. So for those who are at a high risk for developing lymphedema, so for example, breast cancer survivors who've had a axillary lymph node dissection that was completed, or you had a lot of lymph nodes that were removed, then wearing compression garments prophylactically could help prevent lymphedema onset. At this point though, there's still not enough research to support the use of prophylactic compression garment use for those who are at a low risk for developing lymphedema. Next up is air travel or traveling by plane. So air travel has not been found to be a significant risk factor for those at risk of breast cancer related lymphedema onset. So if you're at lower risk for developing lymphedema, then you may not need to wear a compression sleeve. But if you already have lymphedema, then yeah, definitely wear your compression garments. Now, if you're not sure, so you're at risk, but you don't know if you're high or low risk, talk to your lymphedema therapist. Next up is hot environments. So I live in Florida. It is hot here. A lot of people have historically thought that if you live in a hot climate, then you're going to be at a higher risk for developing lymphedema. But so although hot climates don't seem to increase the risk, they could temporarily contribute to increased swelling temporarily. When we also talk about hot environments, it is suggested to avoid saunas. And if you are in a hot environment, especially if it's a new environment for you that you don't typically live in or visit, then definitely monitor your symptoms. All right, so those are some of the major updates that came out from this article on reducing the risk of breast cancer related lymphedema. If you want to read the full article, I do have it linked below in the description. I also have in the description my free e-guide for cancer survivors to learn more about cancer-related lymphedema, how to manage it, and a worksheet on how to track your own swelling. As exciting as these recommendations are for updating some guidelines that have been around for a while, it is always important for you to always work with your own lymphedema therapist, because everybody's risk for lymphedema and presentation of lymphedema is different. So again, work with a certified lymphedema therapist. All right, there you have it. I hope you found this video helpful with understanding some of the updates and recommendations for reducing the risk of breast cancer related lymphedema. Give this video a thumbs up if you found it helpful, and make sure you subscribe to my channel for more lymphedema updates.